Hi, welcome to PH Insights presented by the Pulmonary Hypertension Association. Join us as we delve into patient stories, healthcare updates, and the latest insights on pulmonary hypertension. Hi, it is Angela, and thank you for joining me today. On this episode are two guests, Mark Porter and Angela Michelle, who will share their experience of living with CTEPH and life post surgery. I want to take a moment to give you opportunity to meet our guests and allow them to introduce themselves. We'll start with Mark. Can you briefly introduce yourself and tell us a little bit about your journey with CTEPH?
Yeah, so Mark Porter, and I was in 2020 very active and healthy 47-year-old, and I had got some random blood clots in my leg and saddle pulmonary embolism that is unexplained on what I got it. And the treatment for that was, well, we don't know what happened, so we'll put you on blood thinners for 6 months. It'll break them down, and you'll be able to enjoy life again. And after that 6 months, after starting to feel a little better, I plateaued and then started to decrease again with shortness of breath. And I kept going back to the doctor and, well, it must have asthma. And then my chest started hurting and, oh, well, maybe that's heartburn. And just kind of, I just kept going back and back. And then I ended up getting another second opinion. And this doctor referred me to a cardiologist. And when I went and met with him, they had done some tests that my heart was okay. And the cardiologist was the one who had experience with a local pulmonologist who specialized in CTEPH. And he really wasn't even sure about what CTEPH was. He just knew that this doctor had kind of done this really rare thing. And so he actually contacted the doc while I was there to schedule the different tests I would need to see if I had CTEPH or not. And so when I met with the pulmonologist for the first time, that's when I was diagnosed with CTEPH. And he immediately referred me to UCSD, more evaluation and PTE surgery. And it took about 4 months to get all of the information from my doctor to San Diego with miscommunications. And I just kept following up and just really pushing because my health was just deteriorating so much. And after they got all that kind of squared away, I was invited down to UCSD to have the evaluation and possibly PTE surgery.
Thank you, Mark, for sharing. I just want to clarify there. So you started experiencing symptoms in about 2020, and your journey from symptoms to diagnosis to realizing it's CTEPH and queuing up for surgery was about 10 to 12 months or so.
Yeah, so I had my initial clots in 2020, November of 2020. And then so by spring of 21, that's where I really had plateaued and started going downhill again. And then it wasn't until August of 22 was when I was at UCSD for PTE surgery.
So it seems like once the information trickled down the pipeline of specialist after specialist, and then finally pulmonologists who had experience with this, it seemed to be a fairly quick process. But we know that's not always the case. We know that the journey from initial symptoms to diagnosis is not always as quick as that may seem. I would like to bring in our additional guest here, Angela Michelle, to introduce herself and share a little bit about her diagnosis to treatment journey.
Thank you. Thanks for having me. So, my diagnosis story is kind of long. I first started getting short of breath probably in 2011. Hindsight in 2013, I have the classic symptoms of a PE, and I kept going to my doctor. They kept telling me it was allergies or it was asthma, and they kept putting me on prednisone. This went on for several years. Prednisone will make you gain weight. And so, quite a few years in, being on and off for years, I had put on quite a bit of weight. So now they were saying, well, it's just your weight. So I would try to work out. I would work out to the point of almost passing out. we couldn't figure out why. So I was just living like that, thinking I'm just short of breath. And it was in 2016 that I had a stroke. And that was when they realized that I have a clotting disorder called antiphospholipid syndrome. And I was what is known as CAPS. That's catastrophic antiphospholipid. So my body was full of clots. I had clots in both my carotids as well as bilateral saddle pulmonary embolisms. My body was just full of clots. They actually did not think I would survive. And I was just like in a really bad shape. And obviously I survived. They did send me home on oxygen, but they were like, well, you don't really need it. And so I kind of stopped using it after a few weeks, but I was still short of breath. And then the following year, I ended up in the hospital for what should have been a minor surgery. And during that procedure, they realized that they couldn't put me under anesthesia because my oxygen saturation levels just were way too low. And so that's when they ended up doing a walk test and they said, yeah, you need oxygen. So I had the surgery without anesthesia, just kind of local anesthesia. And I was put on oxygen 24/7. While I was there, they did keep me about 2 weeks in the hospital. They ran a bunch of tests, they did an endoscopy. They could not figure out why my oxygen levels were that low. But they kept talking about ground glass opacity on the CAT scan, but they could not figure out why. And I mean, this was like a full team of doctors. It was at a teaching hospital here in San Antonio. And so I'm talking like 10 doctors in there and they could not figure it out. So I had become a really big advocate because when I had my stroke, unfortunately, two hospitals had missed it. And so it was the third hospital that saved me. And because that happened to me, I had started speaking up and just raising awareness, sharing my journey online. And so when I ended up on oxygen 24/7, I shared that on Facebook and I was like, hey, I'm on oxygen. We don't know why, but you're going to see me on oxygen. And I had an old high school friend who I hadn't talked to in over a decade, but we were Facebook friends. He's like, Angela, I saw your post. I know that you had a stroke last year from a clotting disorder. Now you're having trouble breathing. I really think you have a rare condition called CTEPH. Have your doctors mentioned it? And I said, no. And then he said, you really need to tell them you need to get diagnosed. And if it is this, you need surgery. You're not going to live long with this disease if you don't have some kind of intervention. And so I took this information to my team of doctors locally. They had either never heard of CTEPH because it is rare, or they told me, well, it's really rare. And I was like, cool, cool, it's rare, but I'd still like to get tested. They were a little reluctant. And so, with my friend's guidance, I advocated for myself. And I had to advocate hard for myself for 6 months, demanding tests, demanding, like fighting with insurance companies, arguing with insurance companies. I need this. I need this. Trying to ask doctors to please, like, advocate on my behalf with insurance companies. So 6 months after my friend told me he suspected I had CTEPH, I was formally diagnosed. So I was diagnosed in January of 2018. I was told I had less than 2 years to live without intervention and that my best hope for survival was surgery. But because of my history of clots and me already having a stroke, they weren't 100% sure that I would be a candidate for surgery. So they sent my records to UC San Diego. I waited about 3 months to hear back from them. After 3 months, I was told that they would invite me to evaluate me, and my evaluation would be at the end of July of 2018. So I waited that whole time, both preparing to have surgery or to possibly die, which is a very odd place to be, but that's where I found myself. Luckily, I was a candidate. I was offered the surgery. So I had my surgery in August 7th of 2018.
Yeah, thank you for sharing, Angela. I really appreciate you also being here. I think both you and Mark have this unique, separate journey. I really wanted to bring that perspective in for our audience and really make it clear of how this can look and feel and be different for each person out there. Even though this rare condition connects you, your journey through your diagnosis, through getting to the point where you have surgery can be completely different and unique based on your experience. So just for perspective for our audience to recap, you first started experiencing symptoms around 2011 where you had some issues. And then it wasn't until advocating for yourself, putting yourself out there, that you received a diagnosis in 2018. So that's about 7 years of living and feeling out of breath, tired, exhausted, all of the symptoms that come along, not only with going through a stroke, having a stroke, using oxygen, but just also that undiagnosed CTEPHs. And I want to pick up there. You both got to the point where you went through evaluation. Were there treatments or suggestions before even getting to the surgery? And I know, Angela, you mentioned you were on oxygen, but was there anything else before even getting to the option of surgery once you received your diagnosis?
Yeah, for me, I was oxygen. So I was on oxygen 24/7. And I was also put on a Adempas. And so those were the two things that they did to try to at least alleviate some of the symptoms and help me in, you know, in between figuring out if I was a candidate for surgery.
Was there a similar treatment for you, Mark, or what was that process in between when you were being evaluated or considered for surgery to surgery?
Well, it was probably a combination of both. They put me back on blood thinners, obviously. And then the pulmonologist talked about the Adempas, but I was never put on it. And I don't know if it was just getting hung up in insurance and, and it takes longer than, 5 to 6 months to get approved for it. I just don't know. And so there was nothing more for me except for, hey, stop working out and go back on the blood thinners. And we're going to give this, we're going to send you this UCSD.
You mentioned stop working out. There are recommendations that are given, and it seems like it's being helpful. It seems like, oh, if you did XYZ, this would make you feel better. And that is a unique experience, I feel like, sometimes when it may be an emergency room or it may be someone who's not familiar with pulmonary hypertension, where it's like, oh, maybe you need to lose weight or maybe it's asthma. I know, Angela, your period of symptoms to diagnosis was 7 years. So did you have the misdiagnosed in between of different conditions?
Yeah, so I did have a history of asthma as a child. So they kind of defaulted to that. Like it's asthma, also allergies. I've suffered from allergies throughout my life. So then it was that. As I kept putting on weight, then it became like it's your weight. I do want to backtrack in that you mentioned blood thinners, Mark. I'm also on blood thinners because of my clotting disorder. So I'm on blood thinners for life. And then you actually made me think when we was talking about the exercise, they did send me to pulmonary rehab in preparation for the surgery. I was at that point, it'd been 7 years and I was not able to do much at all. Like even getting up and walking across the room, I was gasping for breath. So the pulmonary rehab was to try to get my body ready for a surgery.
How did they diagnose that blood clot disorder? Because I know they looked at me and they're like, oh, they went through all these different tests, but your disorder I would never even heard of. Is that even another rare disorder?
Yeah, so it's considered rare, but maybe they're realizing it's not as rare as they think it is. They went there because they didn't understand why a 38-year-old woman would have as many clots as I did that fast. The little bit more of the backstory is I was pregnant at the time. It was my first pregnancy. And so they think that the pregnancy hormones can actually almost like ramp up an autoimmune disorder. So it was always there. And I was probably throwing clots that whole time. That almost pushed me into overdrive with the disease. So they almost immediately thought it could be a CAP. So they tested me, but with antiphospholipid, you need two positives at least 12 weeks apart. So they did the first test and I was positive. Then we had to wait another 12 weeks and they retested and it was still positive. And that's when I was like, okay, well, this is why it happened. But luckily, one of the doctors on the team went there pretty quickly, just based off of the amount of clots that I had in my body.
Okay. Yeah, where they don't know while I clotted, they have me on blood thinners the rest of my life as well, because they can't point to anything of what was the initial cause of it. And now that you got CTEPH, we don't want to risk going through it again.
Do you feel like that, Mark, for you is something that you will want to check up on to see if this is a condition that impacts you?
Yeah, and again, I've never heard of it, so I don't know. I guess, I guess I should reach out with the hematologist who does those testing to see, did you test for this? What was it this? So it's very interesting.
Yeah, I think it goes to that greater conversation of advocating for yourself. When you learn more about a condition, which is why we're doing this podcast, you have the tools to equip you to bring back to your team as like, hey, this suggestion, this came up in some information. Have I been tested for this before? I wasn't familiar with it. Should I be tested with this? I think that's one of the benefits of making these connections here because now you're aware of something that maybe wasn't on your mind or your team's mind. I want to come back to now you've gone through the evaluation process and you worked with your teams to get to the point where now you're at a consideration for PTE surgery. I want to start with you, Mark. What was that call like of saying we need to move forward with this surgery?
I would say probably one of the best days of my life, just because, going through something, I can't even imagine going through 7 years like Angela has done, but going through something for, 10 months of undiagnosed, finally having, hey, this is what you have, and we have a plan to address it. So I was very elated when I got that first call from UCSD with the invitation to come down. I had no hesitations, no reservations at all. So it was a great day. It was a great day for me.
Yeah, finally having something that can potentially make you feel better can be very exciting, especially you go through the entire process. You have maybe test run or things that you have to do like pulmonary rehab beforehand. You get to the point of surgery and it seems very exciting. And Angela, coming to your journey with surgery, it can be very exciting, but PT doesn't necessarily work for every single person. Can you share a little bit about you receiving a call that, yes, you qualify for surgery and your experience?
Yeah, so I was really lucky in that my friend from the get-go told me if I did have this disease that I would need to go to San Diego. He said that they pioneered this surgery. It was the hospital that had the most experience with this particular surgery. So when I was actually diagnosed, my doctor said the same thing. He said, based off of your history, I don't trust anyone but San Diego with you. So he sent my records. It was a very interesting time to be in that limbo state of waiting to even get the call from San Diego. So getting the call that I was being invited was just so exciting because it was an opportunity that this was my chance to have a life again. This was my chance to stay alive. Waiting for the surgery was again this liminal state. And I did my best to prepare myself, not only physically with pulmonary rehab. I think it's really important that we prepare ourselves mentally and emotionally and even spiritually for this surgery. So I personally took a lot of time doing a lot of meditating, a lot of yoga, just a lot of preparing myself for the whole process that I was going to go through. And getting out there to surgery, doing the evaluation, it's, scary because it's like, well, if they say no, that means I'm going to die in 2 years. It was just amazing to get the news that it was offered to me. And I took it without hesitation because I knew for me, my choices were death or surgery. And it was a no brainer for me. So I 100% jumped at the opportunity. I will say, if you're going to have surgery, San Diego is not a bad place to have it. So for me, after surgery, I really thought it was going to be the cure. And I think a lot of times, they really tell us, like, oh, this is the answer. And it was amazing. It got me off of oxygen 24/7, but I was still needing oxygen like on exertion or to sleep at night. And I was still struggling to breathe. So my quality of life wasn't there. So in 2019, I went out for another evaluation at UC San Diego, and it was determined that while the surgery took care of the big clots, the distal clots that were further down were not able to be addressed in surgery. And that was still really impacting my ability to breathe. So I was offered balloon angioplasty. I was supposed to have my BPAs in 2020, but as many of us know, COVID did its thing to the whole world. And so I ended up being delayed a total of 2 years. So I lived in another limbo state. Thankfully, I did have them in 2022. My last BPA was May of 2022. I will say for me, the BPAs made the huge difference. While the surgery saved my life, the BPAs gave me back a quality of life that I didn't have before.
Yeah, I think that thank you for sharing that. It's really important to note that there may be many treatments that you have to experience and go through in order to get back to some quote unquote normalcy in your life. And it's great if PT initially works for you and you have that restored quality of life. But I think putting it out there that sometimes that treatment plan or treatment option it's not a one size fits all. There are additional things that need to happen for some. And I will say that PHA, we are sharing more information about the differences between PTE and BPA and how additional treatment may be needed after a surgery. Thank you, Angela. Thank you for sharing that because I think it's important to keep expectations also realistic, right?
Yeah, listening to Angela's story and my story, and then what you've experienced, Angela, is you're talking with other people that have had CTEPH. We're all chasing that quality of life thing. I think that's a theme that we've been hearing is we just want our quality of life back, and whatever that may be. And well, for me, when I went through the surgery, I had no hesitations at all. Hearing Angela's story about preparing herself with the meditation and spiritually, but like, boy, I guess I'm a pretty shallow person because I was just like, hey, I'm just ready to go. Let's do it. I really don't have any reservations. And so I probably really still don't appreciate the seriousness of the surgery because I never was nervous. It was just because I was all in to get my quality of life back. And so when I met with the doctors at UCSD, Angela will tell you they're fantastic. And when I first met with Dr. Madani, I told him my experience of the testing the week before and the clinical doctor, which said, hey, your numbers aren't that bad. That was really a low part of my journey. I was just devastated when I got that news. And then the next day, Friday, yep, we're inviting you back. And I shared that with him. And he says, no, we do this every day. And we know what we're doing. It's kind of routine for us. And he's experienced very active people like me that it is bad, even though some of the testing numbers don't reflect that because of the shape that we're in. And so he gave me a lot of comfort in that of knowing that, hey, this is really the right thing to do. And so it was a good experience. I will say when they finally woke me up, I could breathe immediately, which was really amazing. And I felt great. And then the pain meds wore off. And boy, by day 3, it was like I had just made the biggest mistake of my life. Why did I do this? I'm in so much pain. And they had me up and walking within 2 days and starting respiratory therapy. And I don't know about you, Angela, but that was the thing I dreaded all the time. My wife was there, trying to hound me. Hey, have you done your breathing treatment? Have you done your exercises? Oh, and then when the respiratory therapist came in and wanted me to do the stuff, boy, that was probably my least favorite part. But by the end of the 11 days I was in there, I felt great by the end. I was amazed at how fast I was able to recover from that. And but a couple days before discharged, I was out walking, doing long walks and even going outside. And so I really don't have any issues that way. When I was going to be discharged and released, they did find some inflammation around my heart that they were a little concerned about. They waited. And so they told me they would discharge me from the hospital as long as I stayed in San Diego for another 3 days and came back before they wanted me to come home. And so I did that. And luckily, after the 3 days, the inflammation had stabilized. And so they released me to go home. For me, looking back at the surgery, what was probably one of the worst parts? I got two bad parts, and I'd love to hear Angela on her experiences. But number one, waking up with the breathing tube in and then pulling that breathing tube out. That was not a pleasant experience. But I think even worse than that, because I was more coherent, was the removal of the drain tubes from my chest. And it's not the only warning you get is 1, 2, 3, and then they yank it.
So I'll just share. I agree. Those weren't fun experience for me. I didn't mind them too much. The worst part for me, I think of the whole thing was the misdiagnosis. I agree. Waking up with like the tube in your mouth is not fun. So I was very thankful to get that out. I think maybe for me, I was in 9 days. They got me up and walking pretty fast too. And I also developed something similar to you. I had what is known as pericarditis or pericardial effusion, which is an inflammation of like the lining of the heart fat. And so that happened to me a month after surgery. So I was actually back in San Antonio when that happened. And I ended up locally in an ER, which that was not a fun experience. Local ERs don't always know what CTEPH is or what happened to me. And so they had no clue what I had been through. And so I was in a ton of pain trying to like crash course educate them on CTEPH and PTE surgery so that they could help me. Yeah, I think you both actually make a very, very good point to the importance of awareness like this, and that everyone is aware of pulmonary hypertension as a condition that someone may experience. This, if anything, is clear indication that we need space for early detection, early diagnosis, just in the differences in your story from, 18 months or so from diagnosis to surgery versus 7 years, and how it impacted recovery. It impacted the need for additional surgery, additional treatments there.
And just really happy to hear about, Angela's trying to promote it and be an advocate. And I've tried to as well. And you just never know who's going to be able to pick it up. And I've got two instances. One was he was in his 20s from Mexico, who had kind of picked up on my story and actually gave him and his mom the confidence to go for the surgery. And that's really humbling thing. And then I also shared, again, my story with my inner circle and trying to get it more to an outer circle. Was one of my good friends who's a physical therapist who had a patient that just had the symptoms of shortness of breath. And after reading my story and reading about it, she never heard of it. She brought it to her patient, and come to find out that's what they had was CTEPH, and they were referred to UC San Diego. So I think just getting that awareness out and doing podcasts like this and just sharing our story to give that awareness, because I think it's going to have more effects to help people than what we even realize.
Absolutely. And I know, Angela, that's something that's very important to you and a big part of your platform of raising awareness.
Yeah, advocacy literally saved my life. I don't know if I would have been diagnosed of CTEPH in time had I not started sharing on social media. So I absolutely know the power of sharing our story and it reaching other people. So I had promised myself that if I survived this, I was going to be the best advocate I could. And I have held true to that promise. I am very lucky. I live in San Antonio, which is actually a pretty big city. I did a interview with a local news station, which then got picked up by other news stations. So my story has been shared nationally on news stations. I've written articles for magazines. I've done portrait projects. I'm a photographer, so I have a portrait project called Chronically Beautiful. I photograph people with chronic illnesses. I personally use Instagram a lot to do a lot of my advocacy work. And so that's where you'll see a lot of what I do in the advocacy world. Getting involved with PHA's advocacy has been amazing too. Y'all are amazing at kind of putting us in contact with, especially like my local representatives, to kind of share my story and get that out there. So I take every opportunity to share my story. Just like Mark, I have people who find me a lot of times through a hashtag, and they'll say like, hey, I saw your journey. I think I might have this. And I'll take the time to have a conversation with them, jump on a Zoom call with them and just see like, hey, what's going on with you? Where are you at? How can I help you be better advocate for yourself? And so how do we advocate for the needs of our body, even sometimes when we're met with, like a little bit of maybe some dismissiveness. And so it is a very much journey that I have been on. And if I can help others on their journey, I am always happy to.
Yeah, I really appreciate the fact, you mentioned that we know our bodies, and I feel like I was very fortunate to when I finally got in with the right doctors and whatnot. They mentioned that they were not like, "Oh, we know everything." It was, "Well, you do know your own body. You do know what's going on. We do believe you. There's something wrong. Let's continue to find out where." And I've always, just really appreciated, and not all are like that.
Yeah, once you find that right team that knows and understands that patients are their biggest advocates and they know what's going on with them, I think that is a team that you hold on to as long as you possibly can. I think you transition to a great point here with this call and as we're sharing information. What do you want to say to those who have been diagnosed with CTEPH? Is there any advice you would like to share with those listening?
Yeah, you know that there's hope. I think for me, PTE was the only thing that I needed, and so there's hope. But in Angela's case, she needed PTE was the beginning, and then having these other procedures afterwards. But she's getting that quality of life back, might even have that quality of life back where she wants it. And so I think that it's just having that hope that at least for me, very thankful I was diagnosed because then we can address it. And then we can find the specialists, whether it's UCSD or, the other facilities around the world that are starting to do this, that, hey, there's a plan that they can help treat you with this. Because it seems to me that the people that know about CTEP, they also know how it's treated. And they're going to get you with the right people, the right teams, and the right procedures to go down that path versus, oh, yeah, you have CTEPH, but now we're just going to do this instead. You really don't find that, at least that I've experienced with the doctors that are aware of it. They actually know, hey, who the specialists are, where to go. And so I would recommend it to anyone that has CTAP, whatever their team recommends. I would say do it, whether it's start with PTE or start with BPAs. I think there's a lot of people that I think a lot of us have seen, Angela and I, that have started with BPAs and it's worked for them. And so TE doesn't fix it for everybody, but it's also not for everybody. And so, but I would just say continue to have hope. And anyone that, wants to read my story or reach out to me, I'm very happy to share my story and to talk with anybody about it.
Thank you. Thank you for offering that. I think that's a great point to when you find that right team to listen. Angela, anything you would like to share out to our audience?
Yeah. So I think the journey is a roller coaster. And I say we have to learn to ride the waves, right? Like there's going to be high points where we're like, yes, I have a diagnosis, I have a plan. And then there's low points where we're frustrated or we're not where we want to be. Trust the process, trust your own body. It's really important when we're advocating for ourselves that we know our own body. And I will say that in today's day and age, I feel like a lot of us are disconnected from our body for a lot of reasons. And so, like, tune into your body, find a way to tune in. I mentioned I do a lot of yoga and meditation. So, for me, like, sitting still and meditating and just listening to my body has been huge in helping me to connect to it, to know what it needs, and then be able to talk to my doctors of, like, this is what I'm experiencing. Don't be scared to advocate for yourself and don't be scared to push back. Also, don't be scared to get a second opinion. And there are times where I have to find a second opinion. There has been times where I have to leave a particular doctor because I don't feel like they are equipped to help me and I need to find someone who is. And it doesn't mean that they're a bad doctor or anything. It just means that they're not the right doctor for me right now. So that is totally okay to do. Continue to just stay hopeful. Mark said it, like, stay hopeful. There's a ton of different options out there. I do encourage people to educate for themselves, like educate themselves as much as possible about what the options are, learn about them. I mean, I know they say don't do Google, but I say do Google Scholar, because then we also are speaking the same language as our doctors. Like, when I can go to a doctor and I can say, well, I think I still have distal clot, I'm speaking their language versus just like, I still can't breathe, right? And just trust the process, trust yourself. Like Mark said, I'm also happy to help. Please feel free to reach out to me. I will give you two ways to reach me. You can reach me either by email, that is angelaadvocate@gmail.com, or you can also find me on Instagram, and I'll give you that handle. It's at ELLERAVEN.XO. That's lraven.xo. And you can feel free to follow me, send me a DM. I would love to hear from you. I'm all about helping people to, again, be their best advocate for themselves in their life. One last thing I will say, as we go through this journey, we're going to experience a lot of pain. Mark, we talked about it, right? Like, there's pain in this process. It's also really important that we remember our body allows us to experience pleasure. And that's about quality of life, right? So finding ways to connect to pleasure in your life, whether that going for a walk outside or just sitting, petting my cat or my dog. It's just finding that connection of pleasure in this body and remembering, like, yes, my body is frustrating and it's not where I want it to be, but it allows me to experience this pleasure of being alive.
Thank you so much. I think that is so important to note. We talk so much about the pain, like you said, associated, or the frustration associated with a condition where it almost feels like there isn't hope. But you hear right now from people who had two completely different experiences navigating CTEPH and getting a diagnosis, and yet there's still hope in your voice. And I appreciate you being here to share your stories and to share those differences, and know that, that is okay.
Well, I was just going to comment, on Angela's when she referenced the roller coaster, which was definitely true for me. I think, sometimes I promote my stories. Hey, it was all great. I finally diagnosed, so happy. But again, you've got okay, yes, friends and family have seen me suffer for so long. And then, hey, and then just asking them, always asking, have you found anything out? And just how depressing that is when, no, I haven't heard anything. No, I haven't done this, or no. And then you finally get something like, hey, yes, I've got CTEPH and they're referring me to San Diego. And so then I share that. And then the 3-4 months, hey, have you heard anything from San Diego? Then you're kind of depressed again because, geez, I haven't heard anything and I've got to keep calling them and calling my doctor and they don't know where my stuff is. And I think even in my story, I shared that I didn't even like to talk to or go out with friends and family anymore because that's what they would ask me about. And so it is definitely that roller coaster where you get the highs and you're back to the lows. And then even after surgery, it wasn't just a straight, hey, you're now going to start feeling good and your graph is a linear line upwards. No, it was, hey, I progress up and I come back down. But if you jump that and look at that graph, is a 18-month period of time, it's always working its way upwards. Even though there's peaks and valleys, still in the positive trajectory. So why I say it worked for me, I feel that it did, when I hear stories like Angela and things like that, and to where I've got most of my life back. I'm not 100%. I probably never will be. And I still have good days and bad days, but my good days far outweigh my bad days now. So yeah, so it is a journey, and it's not just an immediate fix. So it's a journey before and a journey after.
I think that is a great point. You have the surgery and you go through that initial process. You have to walk immediately. You have, rehab, but there's still that ebb and flow, those highs and lows you have to work through with relearning your body, getting to the points where you actually feel better throughout the day. And I think just to reference back to what Angela said, to find those pleasures and to find the things that you enjoy to make yourself feel better. It isn't an immediate fix. Although it worked well for you and you're happy with where you are now, Mark, it was that ebb and flow, the high and low of the journey after surgery. And that goes with anything. And I'm glad you made that point. I think that people should just be aware of all the possibilities leading into this. So if you have CTEPH or you think you are experiencing symptoms of CTEPH, we recommend reach out to your medical team, get referrals to a pulmonologist to take the test to be evaluated. I want to thank you both for sharing your story and continuing to be a part of PHA's family and allowing people to reach you and learn more about this unique journey navigating CTEPH. I think that although challenging, both of you have expressed hope and having answers, have expressed hope and trying to get back to a quality of life for yourselves. And so I appreciate you sharing your journey with me today and with our audience. And I want to thank our listeners also for tuning in to this episode. If you have any questions, you can reach out to us here at PHA for more information about CTEPH. Thank you both for being here.
Thank you.
Thank you so much.
And thank you for listening to PH Insight presented by the Pulmonary Hypertension Association. Remember to subscribe and to join us every second and fourth Wednesday of the month for more valuable insight. Thank you for listening to this episode of PH Insights. We'd like to take a moment to thank our sponsors for their support of the PHA Connects program, which brings you the PH Insights podcast. Sponsors do not participate in the development of and do not endorse content of programming. For a list of our sponsors for 2024, please visit our website at phassociation.org/aboutph/sponsors. Thank you for listening.